Hola, gente linda. Hello, beautiful people. Hola is hello in Spanish, and gente linda means beautiful people in Spanish. I'm Nelly C. My goal for my YouTube channel is to study the topics for the licensed clinical social worker exam together and share this material with someone who may need it. My email address is learningtogethertobecomealcsw at gmail.com, just in case you would like to contact me. And here is also my Facebook page, facebook.com Learning Together for LCSW. First, I want to share a quote to continue to be inspired and motivated to carry on with this journey. Then we will continue reviewing the normal growth and development. From medlineplus.gov. I will post a link to this article below this video, and I will post my email and my Facebook page. Thank you for taking the time to watch this video. Don't forget to like and subscribe to my channel if you'd like to continue to get more updates on topics related to the LCSW exam. Let's not give up, and we can do it. Slowly but surely. Adios, mi gente linda, and many blessings. And here is the quote. Let's read it together. If you feel burnt out, tearing in, if you feel demoralized and exhausted, it's best for the sake of everyone to withdraw and restore yourself. If you feel burnt out setting in, if you feel demoralized and exhausted, it's best for the sake of everyone to withdraw and restore yourself. By Dalai Lama. Dalai Lama. Okay, nice quote. Okay, so let's go to Google and we'll share where we are. We actually are in the poverty topic. We already read the school children stage, and now we had to read the poverty stage. So it says, poverty is the time in life when boy or girl becomes sexually mature. It is a process that usually happens between ages 10 and 14 for girls and ages 12 and 16 for boys. It causes physical changes and affects boys and girls differently. In girls, the first sign of poverty is usually breast development. Then hairs grow in the pubic areas and armpits. Menstruation or period usually happens last. In boys, puberty usually begins with the testicle and penis getting bigger. Then hair grows in the pubic area and armpits. Muscles grow, the voice deepens, and facial hair develops as the puberty continues. Both and boy girls may get acne. They also usually have growth spurt and rapid increase in height that lasts for about 2 or 3 years. This brings them closer to their adult height, which they reach after puberty. Here there are more articles, which I think is important to read physical development, what is normal and what is not. And here it is. I have it here. Physical development. What is normal? What is not? Two boys or girls exactly the same age can start or end puberty years apart, yet still fall within what is considered normal growth. The timing and speed of child physical development can vary a lot because this is determined largely by the genes inherited from the parents. Teen growth patterns. Whatever patterns of teen's growth follow, it's during the pubertal years that your son or daughter grows tall more rapidly than any other time in a child's life. Girls, on average, rapid growth occurs around age 11 and a half, but it can begin as early as 8 or late as 14. Boys usually trail behind by about 2 years. This is why 13 years old girls can for a time be head taller than 13 years old boys. Here what usually happens. The hands and feet grow first, frequently causing an awkward body appearance, until the arms and legs catch up. Teenagers may seem to trip over their own feet. Next, the boy's shoulders and girl's hip get wider and the trunk of the body lengthens. The bones in the face grow too, particularly the lower jaw, bringing about a very noticeable change. To help you to recognize many changes that can take during puberty, first remember that every year since the age of 2 or 3, your child has grown an average of about 2 inches and gained about 5 pounds. However, while in puberty, you can expect the rate to double. May grow 4 inches in 12 months by the time his height is complete. He may have added 13 to 14 inches and 14 pounds in 3 to 4 years. See physical development boys what to expect. Girls may gain nearly 10 inches and 25 pounds, including 3 or so inches to 12 months before they begin having menstrual periods. Growth in both boys and girls is slow considerable soon after puberty is complete. Having gained nearly all their adult height during puberty, once the period of development is over, most teens grow no more than another inch or two. You may need to check with your pediatrician to see if your child has completed his or her pubertal development. When to speak to the pediatrician? For boys or girls to be slightly less development or more development than other kids the same age is rarely cause for alarm. But if a child seems significantly different from other his or her age, parents should speak with their pediatrician so that their child can be checked for or most likely rule out any medical problem. Chances are it is a pediatrician who will bring this difference to the parent's attention. Blaming on hormones. Hormones, chemical messages produced by the body glands, travel to bloodstream, affect growth, sexual characteristics, the ability to have children, metabolism, personality, mood swings. Although the triggers that start puberty is not yet fully understood, sometimes between the age of 7 and 11 in girls and 9.5 to 13.5 in boys, the pituitary gland at the base of the brain releases two hormones that signal a girl's ovaries to start producing the female sex hormone estrogen, and boys' testicles to start producing the male sex hormone testosterone. About sex hormone. Sex hormone instructs reproductive organs to develop or mature in preparation for one day being able to have children. Estrogen and testosterone also cause the development of secondary sex characteristics, which lead to male and female difference, such as woman's breasts and rounded hips and men's facial hair, muscle development, the maturity maturing various testicles make increased amounts of sex hormones, further promoting the process of puberty. Additional information: physical development in boys, what to expect; physical development in girls, what to expect; what when each child is unusual short or tall; when puberty starts early. Okay, so let's see what to expect physical development in boys. Physical development in boys, what to expect. Physical development in boys, what to expect. Puberty is crazy time occurs through a long process beginning with a surge in hormones production, which in turn causes a number of physical changes. Every person's individual timetable for puberty is different. Below is an overview of some physical changes boys can expect during this year: enlargement of the testicle and scrotum, a near double in the size of testicle, and the scrotal sac announces the advantage of puberty. As the testicle continues to grow, the skin of the scrotum darkens, enlarges, thin, hangs down from the body, become dotted with tiny bumps. These are hair follicles in most boys. One testicle, usually the left, hangs lower than the other. Pubic hair, fueled by testosterone. The next change of puberty comes in quick succession. A few light-colored down hair materialize at the base of the penis, and with girls, the pubic hair soon turns darker, curlier, or coarser in the texture, but the pattern is more diamond and shaped than triangular. Over the next few years, it covers the pubic region, then spreads toward the thighs, and thin line of hair also travels to the navel. Roughly 2 years after the appearance of pubic hair, sparse hairs begin to sprout on boys' face, legs, arms, underarm, and later the chest. Changing body shape. A girl's physical stretch virtually equals as a boy until the middle adolescence, when the difference between the widest appreciable boys tend to look little chubby and gangling long arms, legs compared to the trunk. Just prior to the onset of puberty, they start to experience a growth spurt and they progress further into puberty, with a peak occurring during the later stage of sexual maturation. Body proportions change during the spurt as there is a rapid growth of the trunk and the legs on the some extent too. Boys continue to fill out with muscle mass long as the girls do so that by the late teens, a boy's body composition is only 12% of fat, less than half the average of girls. Penis growth: a boy may have adult size genitals early as age 13, as late as 18. First, the penis grows in length in the width. Teenager males seem to spend an inordinate amount of time inspecting their penis, covertly or overly comparing themselves to other boys. Their number of one corn, no content size, concerns boys have about poverty. Most boys don't realize the sexual function is not dependent on penis size or that the dimension of the flaccid penis don't necessarily indicate how large it is when erect. Parents can spare their sons nearly distressed by anticipated disconcert rather than waiting for them to say anything. The question is always regardless of whether it's articulate. In the course of a conversation, may muse aloud. Many boys your age worry their penis too small. That almost never turns out to be the case. Consider asking your son pediatrician to reinforce this point at his next checkup. A doctor reassures that a teenager is all right, sometimes carry more weight than a parent. Boys' preoccupation with their penis probably won't end there. They may notice that some of the other guys in gym have foreskin skin and they do not, or vice versa. Might come you with a question why they were or weren't circumcised. You can explain the procedure is performed due to parents or religious custom. Where are these bumps on my penis? About 1 or 3 adolescent boys have penile pink pearly populate on their pen. Pimple like lesions around the crown or corona. Also, tiny bumps are harmless. A teenager may fear he's picked up a form of sexually transmitted disease. The appropriate course of action is none at all, so usually permanent. The populates are barely noticeable. Fertility. Boys are considered capable of procreation upon their first ejaculation, which occurs about 1 year after the testicle begin to enlarge. The testicle now produces sperm in addition to testosterone, while the prostate, the two seminal vesicles, another pair of glands called Kapor glands, secrete fluid to combine with sperm to form semen. Each ejaculation amounted to about 1 teaspoon of semen containing 200 milliliters to 5 milliliters of sperm. Wet dream or involuntary erection. Most boys have stroking or rubbing their penis for pleasure long before they are able to achieve orgasm. In some instances, as far back as infancy, a child may consciously masturbate himself to his first ejaculation or this pivotal event of sexual maturation. May occur at night while he is asleep. He awakes up damp pajama sheet, wondering if he wet the bed. A nocturnal emission or wet dream is not necessarily the culmination of sexually oriented dream. See nocturnal enuresis in teens. What parents can do help? Explain to your son that this phenomenon happens to all boys during puberty and that it will stop as he gets older. Emphasis that nocturnal emission is nothing to be ashamed of or embarrassed by. Know that masturbation is normal and harmless for girls as well as boys as long as it's done privately. Erections too are unpredictable during puberty. They may pop up for or no apparent reason and seemingly at the most inconvenient times, like when giving a report in front of the class. Tell your teens there is not much he can do to suppress spontaneous erection. The time-honored technique of concentration, the most unsexy thought imaginable, doesn't really work, and that with the passage of time they will become less frequent. Voice change. Just after the peak of the growth spurt, a boy's voice box, larynx, enlarges to the vocal cord. For a brief period of time, your son's voice may crack. Occasionally, as it depends. Once the larynx reaches adult size, the cracking will stop. Girls' voice lower in pitch too, but the change is not nearly as striking. Breast development. Early in puberty, most boys experience soreness or tenderness around their nipples. 3 and 4, if no more, will actually have some breast growth, the result of biochemical reaction that converts some of their testosterone to female sex hormone estrogen. Most of the time, the breast enlargement amount of firm breast butt up or 2 inches in diameter under the nipple. Occasionally, this may be more extensive, resulting in profound gynecomastia. Overweight boys may have the appearance of pseudo-gynecomastia lipomastia due to excess fatty tissue on the chest wall. As you might imagine, this development can be troubling for a child who is in the process of trying to establish his masculinity. If your son suddenly seems self-conscious about changing for gym or refusing to be seen without a shirt, you can reasonably assume that he noticed some swallow in one of both or both breath. One particular telltale sign wearing a shirt to go to the swim. Boys are greatly relieved to learn that gynecomastia usually results in 1 or 2 years. Thanks for telling me. I thought it was turning into a girl. It's a common reaction. There are rare instances where the excess tissue does not subside after several years or the breast become unacceptable large. Elective plastic surgery may be performed strictly for the young patient's psychological well-being. Gynecomastia warrants an evaluation by a pediatrician, especially if it arises prior to puberty or late adolescence, when the cause more likely to be organic. Our number of medical conditions can cause excessive breast growth, including endocrine tumors, an adrenal disorder, or congenital adrenaline hyperplasia, a chromosomal disorder, Klinefelter syndrome, liver disease, rare genetic disorder. Breast development may also be side effect of various drugs, including certain antidepressant, anti-anxiety medication, anti-reflexo medication due to exposure to external source of estrogen or estrogen precursor, including ingesting soy and plant estrogen lotion or personal care products such as lavender or tea tree oil applying to the skin. There may be other possibilities in environmental sources, some of which are under investigation, such as certain plastic containers. Additional information, physical change during puberty, concerns boys have about puberty, physical development, girl, what to expect. Okay, let's do that. Physical development, girls, what to expect during puberty. Puberty often begins earlier than parents think, especially in girls. You can help your daughter navigate this time by learning about this change and starting conversation about them early. Here an overview of the major physical change girls can expect as they go through puberty. Breast development. Girls usually begin puberty between the age of 8 and 13 years old. The early sign of puberty is among girls development of breast, Bot's nipple-sized bump under the nipple is not unusual for breast growth to start in one side before the other. It's also common for breast bud to be somewhat tender or sore, and even breast growth and soreness are both totally normal and usually improve with the time. Body hair. Coarse hair will begin to grow in the genital area under the arm, on the legs in some girls, and about 15% pubic hair may be the first sign of puberty showing up before breast budding starts. A word about shaving. Around the time they reach middle school, many girls begin to show interest in shaving their legs and armpits. This is a personal choice. There is no medical reason to shave armpit or leg hair before giving the razor. Show them how to use it properly. Avoid skin retention, cut, which can become infected on tips. Okay, vaginal discharge. Some girls experience a small moderate amount of clear white vaginal discharge. They start about 6 to 12 months before the first period. This is a normal response to growing amount of the hormone estrogen in the body. Periods, while timelines can vary, most girls get their first period within 2 or 3 years after development of breast buds. The average age for girls to get their first period in the United States around age 12. It is important to emphasize that the periods are normal part of growing. Young girls should know that it's okay to talk about periods and ask questions about them. Some young people may have anxiety about how to handle their first period. Even they can happen unexpectedly. Provide supplies, tampons, pants, liners or your child lockers or backpack. Reviewing resources at the school, including the school nurse, can help alleviate this work. While some girls will have bright red blood with their first period, other girls may only have sparring with red-brown discharge. Both are normal. While some people will have periods once a month, periods may be irregular in the first few years as the body adapts to rapid psychological change. Also, normal cycle period can be short as 21 days or long as 30. Or even people with regular cycle may not have period every single month. Abdominal cramping or pain with period is also common. For most people, ibuprofen or naproxen used as a needle are the best medicine to help with period cramp. If menstrual cramps are severe or causing your child to miss school, talk to your pediatrician about other options. Increase in height. Most girls their growth spurt at younger age than boys do. The faster rate of high growth usually occurs in girls between when the breast buds start to develop about 6 months before they get their period. Once a girl has her first period, her growth has already started to slow down. Most girls grow another 1 or 2 inches after they get in their period, but increase height beyond that is less common. Wide hip. Her hip will get wider and her waist may get smaller. Other common changes. Many young people develop acne during puberty. This can be related to changes in hormone levels during this time, sweating under the armpits, and increased body odor also are normal changes. And why most girls begin using deodorant and antiperspirants and the start of puberty with more oil and sweat being made by the skin, girls the same may start wanting to shower, shampoo their hair more often. On occasion, girls start puberty either very early or very late. Contact your pediatrician if you begin to see pubertal change before your daughter's age 8. Likewise, contact your pediatrician if there is no pubertal change and you die by age 12. Parents frequent answer question about girls changing body. So there is a good questions and answer in this article. I won't read it. I just will put the link. I just wanted to have fun information, general information for us for the exam. Okay, my friends, I think this is a good articles to give us an overview about the development, the change of kids during the puberty. I hope this video was good. Thank you guys. See you next video. Bye.